There's only 5 days left in the Washington state legislative session, and a group of healthcare providers here in Washington are asking for lawmakers to raise the Medicaid reimbursement rate.
Yeah, we're talking about licensed midwives who say they want to help women who are on Medicaid, state insurance, but the rate is so low it's causing birth centers to close and midwives to leave the career field entirely. Tonight, what they're asking of state senators and why they say this is important for equitable women's health care.
Midwives like April Hagen and Cynthia Flynn were thrilled when the Washington House budget included higher Medicaid reimbursements and a cap on licensing fees.
The House said, fine, that sounds more than a deal compared to what we're going to pay a hospital, for example. But the Senate said no, nothing.
Flynn manages the Columbia Birth Center in Richland. Yeah. She says they want to help any mom regardless of having Medicaid or private insurance, but at the state's low reimbursement rate, it can take a toll on business.
It makes it really tough because we do have bills to pay and we cannot shift costs the way the hospital can. We want to be a community resource here and to be able to serve the entire community. And still stay open.
Yet Flynn says midwives offer the most personalized care, have a lower rate of C-sections, and improve breastfeeding outcomes for moms and babies. April Hagen with Sky Valley Midwifery says their budget requests are vital for practices across the state.
Sustainability as a midwife is very challenging. The average career of a midwife is 6 years because it's a lot of demand for not a lot of reimbursement. And
for example, she says a midwife who provides prenatal, home birth, and postpartum care for a woman on Medicaid would only be reimbursed about $1,800.
The amount of reimbursement is it's less than half than what other insurance companies would reimburse for the same care.
Hagen says a higher rate would also make midwifery care more equitable. The healthcare authority says women on Medicaid are more likely to be lower income or part of marginalized communities.
Everybody deserves to have good care and to have access to personalized care, not be shuffled through a system just because they can't afford, to have something different.
With just 5 days left in the legislative session, these midwives are hoping their lobbying will be enough for their request to be included in the final budget.
It would mean we could pay our midwives better, right? It would also mean that they felt appreciated for the work that they do. Most of them don't do it because they're going to make money. They do it because they love it.
And the Midwives Association of Washington says midwifery care also saves the state millions of dollars through the care they provide for low-risk families. They're asking anyone who feels inclined to support them, encouraging their district senators to include these requests in the upcoming budget.